Thanks for joining us on this edition of Vaxxed versus Variants. We're going to talk about a lot of things, including the latest information. We're giving you an update and a discussion from a community standpoint and those who've been on the front lines, as well as those who have been fighting this thing in the medical community. All on this edition of Vaxxed versus Variants. But first, here's the latest information and data from the Cuyahoga County Board of Health.
Currently, we have moved through the fifth wave of the pandemic so far. And so with each wave, we've had varying levels of cases that have been reported over that time. Currently, we have over 187,000 cases that have been reported for the Cuyahoga County jurisdiction. Over 7,500 hospitalizations have been reported to date, and over 3,700 deaths have been reported in the county overall today. So when we initially started out at baseline, we were at about 50 cases per day. And as we started to see surges, we moved into the hundreds. From there, we moved to over 500 a day. And from there, we moved over to 1,000 a day. And then in our most recent wave with Omicron, in December and January, we moved to over 3,000 a day. So that gives you a sense of the different waves and phases that we've moved through since the pandemic started. Currently, we're back at baseline where we started back in March of 2020. So we're currently at about 50 cases per day is what we're seeing now as the Omicron surge has subsided. So what we're finding now with vaccination is that there is a range. So we're anywhere from certain zip codes, we're anywhere from 30% coverage in vaccination all the way up to more than 90% coverage in vaccination. And we have found that some of the communities that have the lower vaccination rates are communities that predominantly are made up of people of color. And so it is very important that we continue to push for vaccination within those communities, given the vulnerability of the populations that live there. And so that's something that we continue to work on and something that we think is very important. What we do know is that vaccination decreases your chances of contracting COVID and having severe outcomes in relation to COVID, so in relation to hospitalizations as well as deaths. So with that, we know among those that are unvaccinated, you're 12 times more likely to be hospitalized if you are unvaccinated and you contract COVID-19. We also know that if you're unvaccinated, you're 7 times more likely to have a fatality or a death result as a result of contracting COVID-19. And so we know with those stats, the higher level of those people who are unvaccinated being susceptible to severe outcomes is there. And so that's why we really want to promote and really push for people to get vaccinated, because it's the best protection. Having the pandemic end is not a strategy. So we have to move to continue to work on what we need to do to protect ourselves in order for this pandemic to end.
Thanks for joining us on this edition of Vaxxed versus Variants. Joining us are Danielle Sidnor, president of the NAACP Cleveland, Yolanda Armstrong, the president of Friendly End Settlement, Dr. Latasha Jarrett from the Centers. She is the chief medical officer, and Marsha Maccabee, the president and CEO of the Urban League of Greater Cleveland. First, I want to start off with you, Dr. Jarrett. When I said we are on the front lines, anyone that's in the medical or science profession have been watching this very, very closely. Can you give us the latest update or what you know as it relates to where we are with this virus?
So there are the regulations and mandates are, when we think about our country, are being removed in lots of areas. We see that the public has become more comfortable. We see people not wearing masks, less social distancing. However, as we look throughout the world, we hear in places like Asia where there are new variants of even Omicron and the numbers are increasing. So there is this definite kind of fatigue that we have with the last 2 years of we just want to move on. I know everyone wants to move on. However, the virus may not necessarily be ready to move on. And so therefore we just have this pull and tug of, as we see what happens in the world and we recognize over the last 2 years that what is here in this part eventually will be in another part. And then being able to be mentally prepared as it pertains to going back to the precautions if it does arrive, and being willing to accept that maybe the way we approach life may be a little bit different, and for the present as well as for the future.
Well, all of us have had our own versions of how it's affected us. Talk to us a little bit about being the leader that you are in the community, in the inner city, what you had to do, the safety measures, and all the other things as you helped and took care of people in the senior citizens realm, as well as children, after school programs. How did it affect your organization?
Wow. So much happened during that time. One thing we had to do was work together as a team. Half of my staff were allowed to work from home. They were community health workers that usually have face-to-face visit with families, so they were able to do telehealth. And then the other part of my staff, we were the ones who had to be there every day, working to help families who were in need of food. We had an after-school program at one point in time, but then worked together collectively with the Cleveland Metropolitan School District to basically establish learning pods. So we needed to stay open for families. Had to educate a lot of families in the community because we know majority of the families that live in the community in which we serve, which is in the central area, are people of color. And many of them had already been diagnosed with COVID-19. Many folks didn't want to get the vaccination when that came out. And just trying to be that organization that tries to meet the needs of the people in the community. So we had people who lost their jobs. I can tell you right now, our child care center was affected tremendously because we received vouchers. Because people lost their jobs, they lost their vouchers. We had 98 kids pre-COVID and then ended up with about 10 kids left in our program, which affected our program a great deal. But we were able to partner and collaborate with another organization and start an early Head Start program. They assumed the staff that I had, and then they began leasing out my facility so that they can still provide that service. The win-win for us in Central was the fact that now those parents who had lost their vouchers because they lost their jobs, now that they can bring their kids to the early Head Start program and now go look for a job. One thing about Friendly Inn, we try to do the best we can to serve the people in the community. So we served over 65,000 meals last year, the first year of COVID. And then the second year, we're probably close to that number again. We're in the midst now of looking at our numbers, trying to see the number of people that we served at that time. But I would say out of that, a lot of us recognize the fact that this work can't be done if we didn't work together to get it done. We believe in our mission and vision of our organization, and we want to do the best we could to serve the people in the community. But then it affected us personally because I've had a couple of staff who have lost people to COVID. I myself have lost people to COVID, and it's a trying thing. But I also know that God sustains us. And because of that fact, I think within our organization, we continue to move forward. And as a leader, I had to be that person that when staff came to me about different situations, being open-minded, being empathetic, and then trying to work through those issues, because not just the people in the community were having issues, but then you had staff going through the struggle and then trying to be able to comfort and support them. So I have to say that with the help of our board, with the help of the staff, and then the people who were open-minded and collaborating, this is how we're still standing right now and being able to serve the community.
And just so proud to be a colleague with my sister Armstrong there, who did such amazing work and does such amazing work at Friendly Inn. So at the Urban League, as you know, we had a little bit different approach that we had to take. Because our services are a little different, we focus in the areas of business development, workforce development, and those kinds of things. So we were able to pivot to a purely technology platform to serve our clients. And in fact, we tripled the number of individuals we were able to serve at the Urban League because of serving on a virtual platform. And in particular, you think about business owners who are very busy working in their business every day. They don't often want to take time out to go someplace and take a class or so forth. So by providing these services virtually, they were able to, take less time away, less travel time and so forth, and get involved. The other thing that we're so very proud of at the Urban League was we actually developed a number of other technology approaches in the workforce area, and our SOAR 2.0 that allows individuals to access training, to access information, and to look for jobs right on their mobile device is just an amazing accomplishment that we're very proud of, and absolutely was driven by the need that we saw in the community and our response to it. So we've learned a lot. We would not have known that we had this strength and had these assets had the pandemic not happened. But as we know, we have an amazing, resilient, and resourceful and innovative staff who stepped up to the plate and did just what was needed to serve our community well, and I'm very proud of that. On a personal level, I infected myself after being fully vaccinated and boosted, contracted the Omicron variant. At Christmas time. It was a real different Christmas this year because I was in the bed Christmas through New Year's. But it was a very mild case. I was at home in the bed, not in the hospital, thank God, not on a ventilator, and not all the things that, my precious late husband had to go through because when he contracted COVID, there was not yet any vaccination. So, that of course was a very tough loss, for our family. And this time again, my oldest daughter and grandchildren live with me now, and we all had it. Well, all except for my grandson. Could not figure out how this male child did, but the women, all three of us had it, and we just sort of took care of each other. He did a great job taking care of us too. Bonded us even closer as a family, and everybody was fine. Nobody had to go to the hospital. We got through it, and just grateful, just really grateful. So we try to take everything that happens to us as a lesson learned and try to put it into practice to how it can help our community and how it can help us to go forward in a way that can make a difference.
Danielle, talk to us a little bit about how COVID affected you and how it led you to make the decisions as the leader of the NAACP here in Cleveland.
So it was a very, I would say, interesting time is probably the best way that I can describe it. I have 2 teenagers, so immediately school stopped being what it normally was for them. We were all in the house together. I was working from home. In addition to my full-time job, the places that I serve in community, I felt like every single organization I was connected with was literally on fire, working with seniors in long-term care facilities, working with the NAACP because we also had the social uprising that was happening at the same time, and then in my full-time role working with small business owners. I mean, it was like I went into crisis mode and really never got out of it.
I noticed that even on your social media platforms, trying to combat all the stuff, the misinformation, some of those conspiracy theories, what was it that you feel affected the outcome of so many of us not getting the vaccine?
I think the thing that drove most people that I communicated with not to get the vaccine was their concern about how rapidly it was put together. Because for many people, they got to the place where they recognized, like, okay, the vaccine is actually helping people and it's helping to reduce the number of cases. But there was just this underlying, mistrust or concern about how is it possible that we could put together something so quickly. And so I would do my best attempts to share my personal reasons why I got vaccinated, share why I chose to get my children vaccinated, and then really try and walk people through ways that they could communicate with their doctors or other healthcare professionals to better understand how long scientists had actually been researching the technology that was used in the vaccine. So while it felt very quick, the world was also shut down. And so you had more people at one time working on one issue, and that's not something we usually do.
We are all recipients of getting the virus and being boosted and vaxxed. So there are a lot of people out there, doctor, who are saying, well, they got it, but doctor, we're not on a ventilator, or we didn't have to be on one. Mm-hmm. So what do you say to those who aren't vaccinated and they're talking about, well, they all got vaccinated, but?
That's, whenever you think about vaccines, the first thing is, what does a vaccine do? It doesn't mean that you're not going to get whatever we're vaccinating you for. The whole idea is that if you do get exposed, if you do contract whatever we're vaccinating you against, and in this case, COVID-19, that you would have mild symptoms and not end up on a ventilator. So when individuals say, well, I beat it, well, you don't know if you beat it because you don't know what the long-term sequelae may be, which means the long-term side effects, because enough time has not passed. It's only been a short period of time, and it may be 5 years from now, 10 years from now. It could even be with a very small child who was exposed in adulthood, that there may be medical conditions that we're not aware of that will pose themselves. And we even know now, as they look nationally, and you look at various organizations that talk about individuals who had COVID very early on still have lingering effects a year later, or 2 years later. So how do we know what the future is going to hold? So the best thing to do is to get vaccinated. That way, hopefully, if you do have symptoms, that your symptoms will be mild where you're at home and you're not in the hospital, you're not on a ventilator, or you're not debilitated in such a way that your life is not the way that it once was. And then most importantly, we don't want to be cavalier and say, okay, well, it didn't kill me, I didn't end up. But again, you do not know what the future may hold.
With that said, we are writing the script as we go. There's a lot of things that we don't know, a lot of things that we have found out. From your perspective, from a leadership perspective, and the whole idea behind what do we want it to be said about how we were proactive against this pandemic. And the Urban League, along with the lead from the National Urban League, has been on the front lines. Talk to us about that.
So first of all, I'm so proud of how the National Urban League has really led in this time. We're so fortunate to be a part of such a strong national organization. And in fact, the National CDC has funded the National Urban League to then provide funding through its affiliates, and we're one of those recipients to do a lot of this great work that we do. So some of the cards that we have, the town hall, all of the things that we're doing are as a result of the wonderful sub-grants that we've gotten through the National CDC, through the National Urban League. But as a leader, we know that whenever there is a crisis, we are called often to be both an economic first responder and a health first responder, a social justice first responder. So in that first responder position, we have to do whatever it takes to get the word out, to get the message out, to use our influence, to reach in every portal that we can, to try to bring information, and just to make sure that we're connected. Sister Yolanda talked about the fact that working together. None of us can do this work alone. It takes the true village to really attack an issue like this. And I think when the end of the story is written, as you would often say, Sister Betty, we want to see that our name is in the chapter as one who helped to provide to this community for such a time as this.
Amen.
That was wonderful. Here's the premiere of our PSA featuring the Little Giants boxers from Euclid, Ohio.
COVID-19. We've been fighting an enemy we cannot see. But with every punch, a new variant would arise, and its blows would prove to be devastating. Step by step, with every motion and movement of the virus, the Urban League of Greater Cleveland has stayed off the ropes and in the ring fighting for you. Through the Vaxxed versus Variant campaign, we continue to share information to stay ahead of our next opponent. We've taken some hits as numbers increased, but our eyes remain focused on the prize. As we battle COVID-19, we remain strong, resilient, relentless, and tough like little giants. We will win.
Thanks for watching Vaxxed versus Variants, an Urban League update and discussion. We'd like to thank all of our guests who've participated today, and also reminding you to stay informed and educated about COVID-19 and the pandemic.